Declared a question. Is the motion be agreed to? I call the member for Richmond.
Thank you, Deputy Speaker, and I too rise to speak today in support of the member for Adelaide's motion relating to Asbestos Awareness Week. The motion notes that November is Asbestos Awareness Month, and as part of that campaign, the 25th of November to the 1st of December was National Asbestos Awareness Week. It's so important that we're all critically aware of the devastating impacts asbestos-related diseases have on individuals and indeed on the broader community, especially because Australia has one of the highest rates of mesothelioma in the world. As mesothelioma's latency period is between 20 to 50 years, a peak is yet to be reached in relation to this matter. The Australian Institute of Health and Welfare's analysis found on an average period of 11 months between diagnosis and death. And Australia has one of the highest rates of asbestos-related disease in the world, and tradespeople and renovators are among the most at risk for asbestos exposure. At least 1 in 3 homes built between 1940 and 1990 is believed to contain asbestos, and in some parts of Australia this may potentially rise to as many as 1 in 2 houses. Asbestos was used in over 3,000 products prior to 1990, and a great many of these were in residential construction and fit-outs. What's more, there is no known safe minimum level of exposure. In fact, houses built or renovated before 1987 are highly likely to contain asbestos in fibre sheeting, cement pipes, roofing shingles, guttering, and textured paints and textiles. So many people, especially those in the building-related trades and their families, were exposed to asbestos just from earning their living or going about their day-to-day lives. Thus far, treatment for mesothelioma has been limited to radiation, chemotherapy and surgery. However, immunotherapy is an emerging treatment showing some promising results. In some cases, immunotherapy has provided longer life expectancy to some of those who've been diagnosed with mesothelioma. Keytruda is an immunotherapy medication quite different to the traditional treatments of cancers like radiation and chemotherapy. And I understand that Keytruda has been examined in over 600 worldwide cancer trials with some promising results. Reports indicate that there are also benefits of Keytruda to those with late-stage malignant melanoma, Hodgkin's lymphoma and non-small cell lung cancer. Deputy Speaker, I was very privileged recently to meet with Peter and Nyrie Tillotson, 2 local volunteers from the Asbestos and Mesothelioma Association of Australia, or AMAA. It's a non-profit charity that operates within my electorate of Richmond. The AMAA has an outreach centre based on the ground floor at the Tweed Heads Bowls Club, and it's run by local volunteers who offer a number of support services, including telephone support, home and hospital visits, and monthly support group meetings. The AMAA raise awareness within the community of the dangers posed by asbestos exposure, and they work to minimise the risk of asbestos exposure for future generations. It's a devastating fact that mesothelioma kills approximately 700 Australians per year, and that number, sadly, is predicted to rise in the coming years. Even though Australia banned the use of asbestos in 2003, asbestos-related disease kills an estimated 4,000 Australians every year. This is double our annual road toll. And asbestos is the only known cause of mesothelioma in Australia. Over the last 4 years, the AMAA has been gathering handwritten signatures petitioning for Keytruda to be listed on the PBS. They're doing this because the cost of the medication is thousands of dollars for each treatment, with the number of treatments required unknown at this time. And there are now just over 5,000 signatures on their petition, and I commend them for working so hard in getting all of these signatures. And Deputy Speaker, I now seek leave to table those petitions with those 5,000 signatures collected by the AMAA.
Is leave granted?
Thanks, Deputy Speaker. I'd also like to take this opportunity to commend the Asbestos and Mesothelioma Association of Australia and all their volunteers for their tireless work in raising awareness, also training people to safely handle asbestos and indeed providing important support for the victims of asbestos-related diseases. And I thank them for getting all of these signatures and raising this important issue. Deputy Speaker, the government is well aware of the community support for a PBS subsidised Keytruda treatment for mesothelioma, and I call on the Minister for Health to look favourably upon these petitions signed by those 5,000 people. And Deputy Speaker, I commend the member for Adelaide for this most important motion and raising this very vital issue.
The question